Today I'm going to talk about back spasm and the 3 things you can do to alleviate your symptoms. Firstly, what is back spasm? Now, the body has its own protective mechanism, and it goes into spasm due to an injury or perceived injury known as central sensitization. This is where the nerves in the area become oversensitive due to repetitive flare-ups or chronic conditions which may cause discomfort for what seems to be no apparent reason. In other words, there doesn't have to be any recent trauma for the back to go into spasm. But what actually happens when the back goes into spasm? Now, the body consists of bones, muscles, ligaments, tendons, connective tissue, and they all work together to form the musculoskeletal system. Now, within this system, we have a use it or lose it principle, and the body can become deconditioned to various movements or strains if it's not regularly doing them. So when we bend down, for example, to pick something up off the floor, and we haven't done that in a while, and that increased load or strain can sometimes cause the body to react and go into spasm. So what can we do about it? Number 1, apply ice or heat. Now, I am asked daily, which one should you do? And the simple answer is, it depends. 1, it depends on the type of injury or pain that you're feeling. And 2, it depends on what you've had success with in the past. As a general rule of thumb, if it's a new injury and it feels quite hot to touch, apply ice. If it's reoccurring and feels quite cool in the area, try heat. Now, what you want to do is get the ice or get the hot water bottle, wrap it up in a cloth and apply it to the area for about 10 to 15 minutes and repeat this every 2 to 3 hours. Number 2, breathe. Part of our nervous system is called the sympathetic nervous system, which is involved in our fight or flight response. Now, when our body goes into spasm, the nerves and neurons get excited due to perceived threat or danger, which causes everything to tighten up. And this can prolong the pain and keep our body in that guarded state. So what we want to do is calm the area down, and breathing through your nose for 4 seconds and breathing out for 4 seconds can really help alleviate the symptoms there. Not only will this help relax the muscles, but you'll also encourage gentle movement through the thorax and the abdomen and help promote normal function. Number 3, active rest. Movement is medicine. And whilst it may be tempting to sit around and do nothing, it's actually counterintuitive. So go for little walks, whether around the dining room table or out in the fresh air, but make sure you don't overdo it. This means don't try and lift anything too heavy, don't twist too quickly or make any sudden movements if possible. And remember, gently moving is important, active rest is important. So we need to tell the body that it's okay to move, but do so in a gentle and controlled way.